Pregnancy is a turmoil in itself, but this pregnant mother had it worse. A mother of 4 who was diagnosed with rare eye cancer and had to lose her eye just to make sure her baby was safe. She has now given birth to healthy twins. Her story is an inspiration. The YMCA director, who delivered a baby girl and boy days before Christmas, said she and her husband, a North Carolina firefighter, were relieved when tests confirmed the baby's placentas had not been infected. Though cancer had not affected the infants, the mother of 4, her husband, and their 2 older sons are waiting for the results of a CT scan and MRI to determine if cancer has spread to other parts of her body. Beginning in week 10, though, I bled for 16 weeks, like the longest period ever, because there was blood where my placenta attached to the wall of my uterus and it needed to drain. Then, around the 20-week mark, I developed hip pain so severe that I needed a walker to get around, she told Cosmopolitan. Worried that, on top of everything, the blurred vision I noticed during my 3rd trimester was a sign of preeclampsia, a pregnancy complication often marked by this symptom, I called my high-risk obstetrician several days after I first noticed it. The moment I left the doctor's office with my husband, we both started Googling, and I really began to freak out about possible outcomes. The retina specialist referred me to an ophthalmology oncologist at Duke University Hospital, and I went in on November 15th with my parents and husband. I was 33 weeks pregnant, says the mother. The day after a series of tests, a fellow was examining me when I noticed his computer screen out of my left eye. I could just make out a box that said, "Recommendation, enucleation." Because I'd already Googled treatment options, I knew this meant eye removal. I began to process it in my own way by asking questions about what the procedure would entail. Due to the size of my tumor, radiation therapy would have been of no use for her, she explains. If I kept my eye, I'd likely lose my vision anyway, and it would damage the muscle surrounding my eye, which is important to keep intact for good movement and a normal look when using a prosthetic.